Exosome treatment for Alzheimer's disease. Research on exosome therapy for Alzheimer's disease is only being started, but it has great potential for future therapies. Small cysts called exosomes are released by cells and contain various substances, including lipids, proteins, and nucleic acids. Through their transmission of these chemicals to other cells, they perform important functions in intercellular communication. To treat Alzheimer's disease, exosome treatment entails separating exosomes from donor cells, adding therapeutic cargo that targets disease pathology, and giving the patient an injection or nasal delivery method. Treatment is guided by tracking biomarkers, adverse events, and cognitive function. As further research is conducted, this changing strategy may be able to influence the trajectory of the disease.